Hello, this is Dr. Douglas Berger from the Meguro Counseling Center. I'm here to talk to you today about the major problems seen and the treatment methods used at our counseling center. The treatment method depends on the problem. Major problems we see are stress issues, maladaptive personality style issues, psychiatric illness, and the major treatment methods include CBT or cognitive behavioral therapy, psychodynamic psychotherapy, supportive psychotherapy, and psychoeducation, and psychopharmacology. First problem, stress. We look for the cause of stress and try to remove the stressor and/or modify the person's coping functions to the stress. For example, stress related to romantic relationships. We can commence couples counseling and/or change the format or way of relating of the couple by intervention with one party or two parties. Stress from work relationships. We can engage in psychotherapy to improve the person's way of relating, change the work environment, give career counseling, and other interventions. Even if there is stress, maladaptive personality traits may cause trouble. When an illness like depression coexists with stress, the illness needs to be treated. Problem 2. Counseling for personality disorders. Personality problems or disorders often cause maladaptive relationship problems. Maladaptive patterns are the result of psychological defenses that attempt to protect the person from feeling unloved, having low confidence, being belittled, controlled, etc. Some defenses include attempts to stand out, to control others, being over-dependent on others, etc. Counseling here is aimed at giving the person insight into these maladaptive patterns and defenses and to try to help them move to employ more adaptive styles. Problem 3. Psychiatric illness. Differing from stress and personality disorders, psychiatric illness may not be related to stressful events and usually includes physical symptoms. For example, insomnia or oversleeping, over or under eating, energy or concentration problems, moodiness, depressed mood, etc. Common illnesses include manic depression, anxiety, panic disorder, obsessive-compulsive disorder, attention deficit disorder, and others. The major treatments include insight and psychoeducation, supportive psychotherapy, and pharmacology. Types of counseling, psychotherapy. CBT, cognitive behavioral therapy. This entails improvement of maladaptive cognition, feelings, and behavior. We identify negative or distorted ideas, and modifying them is the key to therapy. Distorted ideas include all or none thinking, amplification, exaggeration, personalization, extracting the negative out of situations, catastrophizing, minimizing, having shoulds, labeling, etc. At the bottom of all this, there are mental schemas that give rise to cognitive distortions. For example, no one loves me. The next type of counseling is psychodynamic psychotherapy. Everyone has certain core issues that threaten one's sense of mental well-being. For example, feeling unloved, inadequate, belittled. And these uncomfortable feelings are kept at bay by the use of psychological defenses. Psychological defenses can be adaptive or maladaptive. The maladaptive defenses tend to lead to trouble. For example, persons who feel unloved may be overdependent and hook up with unhealthy partners. Persons who feel inadequate may not strive enough and avoid challenges. Persons who feel belittled may brag or be arrogant, pushing people away, etc. The therapy of maladaptive defenses would be to give the person insight into their core issues and use of defenses and try to get them to use more adaptive defenses in order to improve their relationships and social and occupational functioning, as well as their psychological symptoms and distress. In summary then, the major types of problems and their treatment. The main problems are stress, maladaptive personality styles, and psychiatric illness, and their treatments include cognitive behavioral psychotherapy, psychodynamic psychotherapy, and in addition, supportive psychotherapy, psychoeducation, and medication treatment may be needed when appropriate for specific patients. This is Doug Berger, American Board Certified Psychiatrist, along with my staff at the Meguro Counseling Center. We're happy to help you if you need help anytime. Thank you very much.